Okay, Happy New Year, everyone. I'm Dr. Leong from Face and Body. This is Fran, who is our cool sculpting expert, and we have lovely Monique here, who is our model today. So we thought we'd kick off the new year talking about fluffiness. No,
she's not
Monique is not fluffy. She's our model. But this is the time of the year when we've all overindulged over the holidays. We've all kind of said, you know, screw it. It's almost 2020. I'll start again with a new year. So that's what we want to focus on today, because Fran and I are going to have a friendly little tete-a-tete. We're going to go back and forth and just look at the different areas of concern that Monique has and say whether or not we think she's better for cool sculpting, for liposuction, for both, or for neither. So a lot of audience participation. Please go ahead and enter your questions or any comments that you have, and we'd be happy to address them. Okay, so kind of the most popular areas that people are concerned about when it comes to extra fat or kind of contour irregularities is the stomach. So Fran here, you know, she looks at the stomach a little bit differently than I do, because I kind of look at it as one whole area. Whereas for cool sculpting, and you can see our cool sculpting devices right here, we've got 2 of them, so we can do twice as many areas all at once. She breaks it down depending on what fits into her applicators. This thing. So I'm going to let her kind of talk about it, because when I look at Monique, I think she could go either way. You know, because for her, she's got a great shape. She's in great shape. But I'm sure if we do a little pinch test, and she'll tell us too, there are little areas that she wishes were flatter or tighter or smoother. I'll let her say that too.
Just the whole area is smoother because it's just, you know, little, like, just not smooth. And then just this area too.
Mm-hmm. Which is a very common problem area for women. This is where we tend to hang on to the fat. So even if she's, you know, working out, she's doing a lot of HIIT, she's doing a lot of core exercises, it may still be soft in this area, and it's annoying. And she has a daughter, but her daughter's 24. Yeah, so that was a long time ago, and she's in fabulous shape, but it's just, you know, there are areas that she's like, what can I do? So for me, when I look at her, I'm like, yeah, we could do a one and done. We can lipo you, tiny little incisions, just go in and just treat this whole area and kind of come around the love handles too. That way we'll take as much fat as we need to flatten everything out. We'll get some definition of her abs here. We can even create it if we wanted to. And then she would have one recovery period, wear a garment for a couple of weeks, and then be ready to go to Tahiti in, you know, a couple of months. But then she might say, you know, Dr. Leong, I work for Dr. Park, and I don't get any time off, and so I can't do that, even though I would love to. So then I'm like, well, okay, we'll go see Fran. And Fran?
Well, with cool sculpting, we would choose the areas of her concern, which is love handles. So we would do some applicators on her love handles. We'd have to do probably 2 treatments. We would treat here and right here in this bra area to kind of curve her out more so she doesn't have any indentations here.
How do you decide how many treatments she needs? Like what do you look at? Is it a pinch? Is it inches?
It's a pinch, and you just kind of want to roll and make sure it's not skin and that there's some volume in there that you can decrease it rather than just treating skin and won't do anything for.
Okay, so if she gets 2 treatments, what kind of result should she expect with that?
So you lose up to 20-25% of the fat in the area, so she could go in a good amount with the second, smooth her out.
Okay, and how long would it take her to complete the 2 treatments and see her results?
So after the first treatment, I would say wait at least 6-8 weeks, do the second, and after 90 days after the second treatment, you'd be complete.
Okay, so then if she says, you know, I really want like a tiny little waist, can I do that with cool sculpting? What would you tell her?
With that, if she wanted to go completely in, like to the bone, I would definitely send her to you and your aggressive lipo, because that's what every woman wants right there.
Yeah, the little nipped-in waist trainer look.
Yeah.
Which, by the way, you can still do waist training with both lipo
Yes.
and cool sculpting, because, you know, it actually does work. It helps to reposition the muscles and teach them how they want to be with a tight core. Okay, so what about the abdomen? So you talked about the love handles, but what about the tummy itself? Is that one area like for me, or is it more than one area?
No, we would have to do with her probably go this way to get this, and you want to hit the peaks of the bulges because that's where the applicator gets the coldest. So we would do one here, here, and then here and here. So when you do a diamond shape, it pulls in and kind of helps with the curve there in the tummy, and then pulls in this way.
And would that be two
Yes.
treatments
Two,
too?
possibly three, just to get it as flat as could be.
Okay.
But yeah.
So when you do cool sculpting like that, and you're pinching it this way, which I assume is how it fits into the applicator.
Yes.
How do you know that it's going to be an even treatment? Because how do you know that it won't just treat the fullest part and then
Because we'll marker, it does get coldest in the center, and that's why you want to kind of right where it bulges out the most. In these little areas is where you would want the center of the applicator to be, so it does an even treatment. So it'll get coldest here, and then smooth this out, and then this out the most. So it'll all even out.
So Monique is fairly symmetric, everything's pretty smooth. What do you do for people when I feel like we see a lot of them who are kind of asymmetric? There's more of a bulge on one side than the other. Do you change your treatment algorithm and your recommendations?
Yeah, so a lot of people have like a heavier lower belly than upper. Even Monique here, just a tiny bit. So maybe just 3 treatments lower and then 2 on the upper. But it would just kind of depend after the first initial treatment where we would want to go from there.
Okay. So the thing I like about cool sculpting is that, a lot of times with the liposuction, I'll take down as much as I can. But what I'm doing is by feel. So I can take out as much or as little as I feel is necessary to give you the shape you want. But sometimes when everything heals, you might still be like, oh, well, there's like this little something here or a little something there. And then, instead of going back to surgery, then I say, let's do a little cool sculpting. Because that gives you a finessing type of effect, your finishing touch, or like a beer chaser after a tequila shot, however you like to think about it. And there are little areas that work really well for that, not just in this area, but also, like we talked about, like bra fat. So everyone hates that, this little bulge that just happens above the breast. And has nothing to do with diet or being fat at all. It's just, we are prone to having fat there. I mean, skinny little mini people have it, larger people have it. I think pretty much everyone in this room, and there are 5 of us in here, could probably say that if I wore a tube top, I would have something here and I wish it weren't there. So cool sculpting is excellent for that. It's not really necessary to do lipo. That's like kind of overkill for something like that. And you get excellent results with probably just like 1, maybe 2 treatments, depending on how much you have.
Definitely.
Yeah. Okay, let's have Monique turn around. Huh?
Oh, we're just doing
okay.
back. Just this little area there.
Yeah, so Fran already
Here,
mentioned her love handles, and with love handles, can I uncover it?
Yeah, I zoomed in.
So love handles, or a little muffin top area, is the flank area, and it's kind of this that we can grab. For most people, when they wear their pants, it's what they see that bulges above the waistline, and most people, I can probably tell you, say they hate that. And then on top of that, we have the upper back, which Monique doesn't really have, a little bit. But you can see here where her waist nips in, above it, there's a little bit of fat that we can pinch. So again, these are both areas that could be treated either with cool sculpting or with liposuction. For me, the goal of this is to really pare it down, because then it'll help shape the buttock too, and we can go into that at another time about buttock augmentation and how lipo is the most important part of it. And then we sweep that up the back to kind of finish off the area. The thing with liposuction and with cool sculpting, I'm sure Fran will tell you, is when we reduce fat in one area, it will not come back in that area, because we are either using cryolipolysis, which is freezing the fat to completely destroy the fat cells, or we are mechanically removing them so that they don't return. However, if you do gain weight, you might notice that you start gaining weight in areas that have not been treated. So very common areas, again, are up here around the bra, and then also on the front, kind of in the mons area, which is this portion, people really hate. And we've noticed it with tummy tucks too, after tummy tucks and the lipo and everything nice and flat. All of a sudden you say, why am I so puffy down there? So fat tends to go where it is uninhibited. Those are common areas, inner thighs also, and then kind of the outer thighs are the saddlebags. So where we treat, the fat will not come back. If you gain a lot of weight, it will come back in that area because it has to go somewhere. But common things being uncommon, it will go where it is unimpeded and welcome. So then you always have to think, we always try to think ahead too, to plan so that you don't have these issues down the road. But if it does happen, that's why. Okay, so I know Monique's like, all right, when do we get to do this?
I know. Let's do it.
Let's do it.
Let's do lipo and Coolsculpting.
Let's do a little both.
Wait, I'm still waiting for my boobs.
Oh yeah,
Just
and
after
that
me.
There's a line. Okay, so if you're interested in either of those, if you have more questions, please feel free to reach out through Facebook, through Instagram, come into the office to meet us, meet me, meet Fran, meet Monique, and we'd be happy to address any of those questions for you.